you would have never expected this, but Tennessee is now leading the country in providing long-acting reversible contraception. One of the biggest risk factors for infant mortality and one of the biggest risk factors for having a baby with neonatal abstinence syndrome, two areas that as healthcare leaders we all care about, is having an unwanted pregnancy. Successes Tennessee is leading the country in terms of providing voluntary reversible long-acting contraception. They're even going into jails and offering it again to folks on a voluntary basis as a way of combating the opioid epidemic. Many hospitals are instituting neonatal abstinence syndrome protocols, just having a standard protocol so you aren't engaging in a shotgun approach based on who's on that shift. Cuts hospital stays for babies born with neonatal abstinence syndrome in half. That's another success. I was in Huntington, West Virginia just a few weeks ago in the epicenter of the opioid epidemic, and they've been able to turn around their opioid overdose rates through, number one, providing peer recovery coaches to individuals, number two, making sure naloxone's available throughout the community so you save the life and you connect them to care, but then number three, having strong partnerships between the public safety and the medical communities. And then finally, many of you all are aware that I was the state health officer in Indiana during the Scott County HIV outbreak. Town of 4,000 people that now has over 230 cases of HIV. A rural community, almost all white, high unemployment rate, but a place where you would never expect to have an HIV outbreak. And we instituted a syringe service program to respond to that in a place where that was not a popular decision and in a state where at the time it was illegal. But through partnerships with the faith-based community, with the law enforcement community, with the business community, and with the medical community, we've been able to turn around that HIV epidemic and start rebuilding that town. So those are just a few small examples of successes. But another part of this epidemic was that we squeezed the balloon in one place, and as prescribing went down, people switched over to heroin. Well, it's important for folks to know that through law enforcement, through partnerships with the public health community, through an increase in syringe service programs and other touch points, heroin usage is now going down in most places. But what we're seeing now is that there is a third wave of the epidemic, and that's fentanyl. Fentanyl and carfentanil, many times more potent than morphine and heroin, can be instantly deadly. And so we're doing the right things, and we're seeing inflections in various parts of this response. We will get over it, but ultimately we need to get upstream and deal with mental health and deal with a lack of wellness in our communities, because if we keep squeezing the balloon, it's going to keep popping up in other places. We've got to get upstream and deflate that balloon that is addiction.